Hello students, welcome to this session. So fourth is the clinical microbiology.
Hello students, today we will see the introduction of microbiology. So what is microbiology? It is study of microorganisms like bacteria, virus, fungi, parasites. It is called as microbiology. So first is scope or application of microbiology. So first is in microbiology there is identification of microorganisms like bacteria, virus, fungus and parasites, and then report of sensitivity is done for the treatment of the patient, and some serological reaction studies is also done for fast diagnosis of the disease, that is called as indirect diagnosis of the microorganism. So examples of that is rheumatoid arthritis test for rheumatoid arthritis, ASO test for rheumatic fever, CRP test for inflammatory disease, HBsAg test for hepatitis B, VDRL, this is venereal disease research laboratory test for syphilis, HIV, human immunodeficiency virus for AIDS, acquired immunodeficiency syndrome, HCG test for pregnancy, Vidal test for typhoid fever. So these are few serological reactions for the diagnosis of the disease and then treatment of the disease. Thank you. Hello students, today we will see basic requirements in microbiology laboratory. So there are some glasswares required like petri dishes for culture media, cavity slides for motility testing, tuberculin syringe for Montauk's test, wire loops for inoculation of sample, microscopic slides and cover slips for smear making and staining like gram stain, Zn stain, spirit lamp or Bunsen burner for heating, sterile swabs for specimen collection, or inoculation of sample for antibiotic sensitivity testing. Instruments like microscope for microscopy of stain smears like wet mount preparation, or stain smears like gram stain, Zn stain. Autoclave sterilization of glasswares for culture media. Then hot air oven sterilization of glasswares, incubator for growth of microorganisms and antibiotic sensitivity testing. And culture media routinely blood agar, nutrient agar, Mekong agar, etc. are required. So this is basic requirements in microbiology laboratory. Thank you.
So first we will see definition of sterilization. What it is the process of freeing an article from microorganisms including their spores. In physical method, it is of two types, heat and radiation, and in heat it is again of two types, dry heat and moist heat. In the details methods in dry and moist heat we will see later on, and in radiation it is ionizing and non-ionizing, and that we will see later on. In mechanical removal methods, it is filtration, and it can be air, that is disinfection, and liquids, it is sterilization. In physical method of sterilization, first one is dry heat. So in that mechanism is protein denaturation, damage by oxidizing molecules, destroying cell constituents, and toxic effects of elevated levels of electrolytes. So all these cause the cell death and the killing of the microorganisms. And the examples or methods are flaming, incineration, and hot air oven. So next method of physical sterilization is incineration, and in that it is an excellent method of destroying materials such as contaminated cloth, animal carcasses, and pathological materials. So in physical method of sterilization by dry heat, the next example is hot air oven. In that, microorganisms are killed by oxidation effects. The oven utilizes dry heat to sterilize articles, and holding period is 1 hour. For the temperature, holding temperature is 160 degrees Celsius. There is a thermostat controlling the temperature, and it is double walled insulation, so that keeps the heat in and conserves the energy. So next type of physical sterilization is moist heat. So mechanism is killing of microorganisms by coagulating their proteins, and so disturbing the cell structure and then the cell damage. And the methods are temperature below 100 degrees Celsius, in that pasteurization and inspicitor, these are two examples. Then second is temperature at 100 degrees Celsius, so it is by boiling. Then steam at atmospheric pressure, so example is Koch or Nord steamer, and the steam under pressure, example is autoclave. Now the next example, moist heat, is inspicator. So it sterilizes by heating at 80 to 85 degrees Celsius for half an hour for 3 successive days. And the use is sterilization of Lowenstein-Jensen media, that is used for the cultivation of Mycobacteria tuberculosis, and Loeffler's serum, that is used for the cultivation of Corynebacteria diphtheria.
Hello students, let's study moist heat. So in that we will see autoclave in detail. So it also called as steam sterilizer. The principle, when water is heated in closed container, it produces vapor and then it causes vapor pressure. Then when water boils in closed container, the vapor pressure is increased more than the atmospheric pressure, and then it has a more penetrating power to kill the organisms. And the mechanism, killing of organisms by irreversible coagulation, denaturation of enzymes and proteins. The types of autoclave are horizontal when it is in large volume, and it is mainly used in CSSD department. And the vertical one is in small volume, used in most laboratories. The components, there are three main components: pressure chamber, lid and electrical heater. So pressure chamber is consists of the large cylinder, either vertical or horizontal. It is made up of metal or stainless steel, and it has a steam jacket, that is water compartment at the bottom. The lid, it has discharge tap for passage of air and steam, pressure gauge for the pressure measurement, and safety valve to remove the excess steam. An electrical heater, it is attached to the jacket that heats the water to produce steam. The working procedure: the materials to be sterilized are placed inside the cylinder. A steam jacket is filled with sufficient water, and then lid is closed with the help of clamps, and the electrical heater is put on. Now there are three phases. So first is conditioning phase, second is exposure phase, and third is the exhaust phase. So in conditioning phase, you have to give condition of temperature, pressure and time. That is temperature 121 degree Celsius, pressure 15 lbs and time 15 minutes. So after the water boils, the air in the chamber is completely displaced by the steam. So the steam pressure rises and then it reaches to the desired level, that is 15 lbs pressure. Then the safety valve opens and excess steam is removed out. Exposure phase, the holding period is for 15 minutes. Exhaust phase, so after the holding period is over, the electrical heater is switched off and the steam sterilizer is allowed to cool till it reaches the atmospheric pressure, and then the material inside is removed. The care and maintenance of the autoclave. So we have to always put water in steam jacket. Do not forget to put off gas burner after the holding period is over. Never leave autoclave unattended when pressure is rising, and never open the lid immediately after heating period is over. So we have to allow it to cool and then open the lid. Sterilization control: physical conditions like temperature, time and pressure. Chemical indicators like external pack control, that is autoclave tape, or Browey test or internal pack. The biological indicator: spores of Geobacillus steothermophilus are the best indicator which kill spores, in which the spores are killed in 12 minutes at 121 degrees Celsius. Uses of autoclave. So there are mainly two uses: hospital uses and the laboratory uses. In hospital uses, the sterilization of surgical instruments, anesthetic equipments, dental instruments, implanted medical devices, surgical drapes and linen, biomedical waste treatment for disposal. Laboratory uses: sterilization of glassware, test tubes, slides, pipettes, petri dishes used in the laboratory, sterilization of culture media for preparation, inoculated infected culture plates, killing of microorganisms and the spores.
Radiation. So non-ionizing radiation, they are electromagnetic rays with larger wavelength. They absorb heat and can be considered as hot air sterilization. They are used in rapid mass sterilization of pre-packed syringes and catheters, and the method used is UV rays. In ionizing radiations, X-rays, gamma rays and cosmic rays are used. They have high penetrating power, but there is no appreciable increase in the temperature, so it is also called as cold sterilization. And the uses is sterilization of plastic syringes, catheters, grease, fabrics, metal foils. Thank you.
So disinfection is destruction of all pathogenic organisms. Antiseptic is an agent which is applied on skin or mucous membrane to prevent infection. Bactericidal agents are substances that kill bacteria. Bacteriostatic agents which prevent multiplication of bacteria. So types of disinfectants are alcohols, aldehydes, dyes, halogen, in that iodine, chlorine, then phenols, metallic salts. So first alcohol. So nowadays we are using it as a sanitizer. So it is 70 to 80% alcohol, and it kills all the viruses. Then aldehyde, it is formaldehyde, which is used in a concentration of to prepare formalin, and then it can be used as a preservative in histopathological specimens. Then glutaraldehyde, which is usually used to disinfect heat sensitive instruments like cystoscope, bronchoscope. Halogens, they can be iodine, which we use as a brown color substance for the skin disinfectant, or chlorine, which is used for the chlorination of water or swimming pools. Then surface active agents like Dettol we use as antiseptic. So this is a concentration chart: glutaraldehyde 2%, phenol 5%, sodium hypochlorite, which we use to destroy HIV doubtful stains on floor or on any instrument. Then chlorhexidine 1 to 4%, povidone iodine 10%. Usually before surgery we clean the skin surface of patient. Alcohol 70 to 80% that we use as a sanitizer nowadays. Thank you. Hello students, today we will see about bacterial cell. So components, what are the components? There are coverings of the bacterial cell. So outermost covering is called slime layer, and the function of this is protection of the bacteria from antibiotics and disinfectants. Second covering is capsule. So it is gelatinous substance secreted by bacteria which becomes thick to form capsule around the cell wall, and function is protection and demonstration by India ink preparation, that is negative staining. An example of capsulated bacteria are pneumococcus, and fungi is cryptococcus. Cell wall, it is outer layer of bacteria, and function, it gives shape and rigidity to bacteria. Cell membrane, the inner membrane, inside the cell wall there is a thin semi-permeable membrane, and function, it controls inflow and outflow of metabolites. It gives mechanical strength to the bacteria. Cytoplasm, it is a liquid and water liquid suspension in which water and organic inorganic substances are there, and plus organelles are there like mitochondria, which is for the powerhouse of energy, ribosomes for protein synthesis, Golgi complex for protein synthesis, endoplasmic reticulum, so it is a network of cells in near the nucleus for the protein synthesis. Lysosomes, they are sac-like structures present for the destruction of the foreign material. Nucleus, it is long filament of DNA coiled inside cytoplasm. As bacteria is prokaryotic, the well-defined nucleus is not there, and no nuclear membrane and no nucleolus. Function of nucleus is bacterial division, antibiotic resistance to carry from one cell to another cell. Plasmid, it is an extra genetic material present, and it is function as a transfer of genetic material. Thank you. Hello students, now today we will see special structures of bacterial cell. So first is flagella. So flagella in motile bacteria, they possess one or more long unbranched filament, that is called as flagella, and function is, it is organ of motility or locomotion. Demonstration, it can be demonstrated by dark ground microscope or electron microscope, or motility testing, that is hanging dropped preparation. Classification of flagella according to the arrangement is: peritrichous flagella are all around the cell, monotrichous single flagella at one pole, amphitrichous single flagella at two poles, lophotrichous group of flagella at one pole. And here in this diagram you can see the flagella arrangement. Second structure is fimbria or pili, it is organ of attachment. Next structure is spores, so they are highly resistant, demonstrate state of this bacteria, not destroyed by boiling, and they are destroyed by or killed by only autoclaving temperature 121 degrees Celsius for 15 minutes and 15 lbs pressure function to survive the bacteria in adverse condition. Demonstration by special staining gram stain Zn stain. Thank you. Hello students, today we will see bacterial classification depending on the gram staining reaction. So gram positive are purple in color and gram negative pink in color. So cocci gram positive, they are staphylococci, streptococci, pneumococci or enterococci, and gram positive bacilli, they are divided into aerobic and anaerobic. So aerobic are bacillus spore forming and anaerobic spore forming are clostridium. Then gram negative bacteria cocci are Neisseria, and gram negative cocci are gram negative bacilli are divided into different classifications. So one can be according to the lactose fermenting property on Meconium agar, they are lactose fermenting and non-lactose fermenting. So lactose fermenting bacteria are E. coli and Klebsiella, and non-lactose fermenting bacteria are Salmonella, Shigella, Proteus, Vibrio, Pseudomonas, Acinetobacter, etc. Thank you. Hello students, today we will see bacterial physiology, that is bacterial growth curve. So when bacterium is inoculated into a suitable culture media or liquid media and incubated, its growth follows a definite course, and that curve is called as bacterial growth curve. There are four stages in bacterial growth curve. First is lag phase, LAG. Second is LOG, log phase, then stationary or exponential phase, and then log phase or exponential phase, stationary phase, and decline phase. In this diagram you can see these four phases. So what is lag phase? So immediately after inoculation on culture medium, there is no appreciate increase in number, but there is increase in size of the cells. So this is called lag phase. Log phase, after the adaptive to the new environment, bacteria multiply, and then it is also called as exponential phase. There is increase in bacterial number, bacterial count. Then stationary phase, after log phase, cell division stops because of decrease in nutrients and accumulation of toxic products, and then the bacterial count is static. And then after that, bacterial count decreases because of the death of the cells, because of the toxic accumulation, and this is called as decline phase. So these are the four phases of the bacterial growth curve. Thank you.
Microscopy, compound microscope principle. A microscope is used to produce an enlarged and well-defined image of objects too small to be seen with naked eyes. The degree of enlargement is called magnification or magnifying power of the microscope. Parts are mechanical parts: base, stand, handle, and stage. Magnifying parts: optical lens system, objectives 4x, 10x, 40x, 100x, and eyepieces. The 10x is low power, 40x is high power, 100x is oil immersion lens, and 4x is a scanner. Illuminating parts: condenser, iris, diaphragm, and mirror. The uses of parts: base gives stability to microscope, stage to keep slide on it, objectives for magnification of object, eyepiece to see magnifying image, condenser to pass light from lamp, iris, diaphragm to reduce or increase the amount of light by reducing or increasing the opening, mirror to pass sunlight on object. Types of microscope: simple microscope to see insects, compound microscope to see bacteria, fungi, parasites, electron microscope to see viruses, phase contrast microscope, examination of living material like spirochetes, motility. Diagram microscope, condenser is the important part to see spirochetes. Fluorescent microscope, diagnosis of tuberculosis by staining with the fluorescent lights.
So students, use of gram staining is for the differentiating bacteria into two large groups, that is gram positive and gram negative. And if they are round 1 micron in size, they are cocci, and if they are 2 to 10 micron size, that is rod shape, they are bacilli. So total 4 types of bacteria are there: gram positive cocci, gram positive bacilli, gram negative cocci, gram negative bacilli. The principle of this gram staining is based on total three theories. So first is pH theory. So gram positive bacteria are more acidic as compared to gram negative bacteria, and that is why they have strong bonds with the basic dyes what we use, that is crystal violet. Then cell wall of the gram positive bacteria is thick because of the thick peptidoglycan layer, teichoic acids present in that, and less lipid. So because of that there is strong affinity and retaining property of the principal stain, that is crystal violet. And gram negative bacteria, they are, the teichoic acid is absent, cell wall is thin, and they are less acidic and more lipid in cell wall. So after the so there is less strong bonds of the with crystal violet, and plus after decolorization the pores are formed because of the lipid is dissolved in that acetone alcohol, and through which the stain is removed or washed. And that is why gram negative bacteria do not retain crystal violet color, and therefore they are stained by counter stain, that is safranin. So reagents used in these are mainly four: crystal violet, that is principal stain which stains bacteria violet, then gram cyanide, it is acting as mordant, and then decolorizer alcohol acetone which decolorizes the slide in gram negative bacteria, and safranin which acts as a counter stain in gram negative bacteria and gives pink color to the gram negative bacteria. So we already saw the procedure. So that is, first you have to pour crystal violet, wait for 1 minute, then wash, then pour gram iodine, then wait for 1 minute, then wash under tap water, then decolorize for few seconds with acetone alcohol, and then apply safranin with 1 minute, and then wash, and then dry, put oil, and then see under microscope, oil immersion lens. So here you can see the cell wall of the gram positive and gram negative bacteria. That is, already I mentioned that in cell wall of the principal, that is thickness of gram positive is thicker, gram negative thinner, and then pH is more acidic in gram positive, therefore more strong bonds are formed with basic dyes. Gram negative bacteria less acidic, so less strong bonds are formed. So here pictorial diagrammatic presentation of gram positive and gram negative bacteria, in which here you can see in gram negative bacteria lipopolysaccharide layer is more, and in gram positive bacteria cell wall is thick because of the peptidoglycan layer is more, and plus teichoic acid. So here you can see now gram positive bacteria, they are violet in color, and gram negative bacteria, they are pink in color. And if they are cocci, they are round, they are called as cocci, and if they are rods, they are called as bacilli. So few examples of gram positive bacteria, they are streptococcus, staphylococcus, pneumococcus, and in gram positive bacilli, they are corynebacteria, bacillus. Then gram negative bacilli, they are E. coli, Klebsiella, Salmonella, Proteus, Shigella, and gram negative cocci, they are Neisseria group, that is Neisseria meningitidis and Neisseria gonorrhoeae. Principle of Zn staining is the organisms like Mycobacterium tuberculosis, which causes tuberculosis, and Mycobacterium leprae, which causes leprosy, are acid fast. So that means they are resistant to acid treatment. So that is why it is also called as Zn stain or acid fast stain. So this acid resistant to acid treatment is because of the lipid containing in the cell wall of this mycobacterium, that is mycolic acid, and because of that they are not decolorized by strong acids and alcohols after they bind with the carbolfuchsin, that is primary stain. And then because they are not decolorized, they are not stained by counter stain, they are stained by carbolfuchsin, that is pink in color. That is why in blue color background or other bacteria are blue in color, pus cells, neutrophils are blue in color, and then you can see pink color rods of the mycobacteria, either tuberculosis or leprae, according to the sample. So in tuberculosis it is sputum sample, and in leprosy it is skin scraping. So here you can see reagents, that is carbolfuchsin, it is as a principal stain, sulfuric acid 20%, it acts as a decolorizer, methylene blue counter stain, and specimens for the Mycobacterium tuberculosis is sputum, and for Mycobacterium leprae it is slit skin smear. So procedure we already saw. First you have to heat fix the smear, make smear, heat fix, and then pour carbolfuchsin, again heat for few films you will see, and then wait for 5 minutes. So this heat gives you fixation of the smear, and then you have to wash and decolorize with the 20% H2SO4, then wash and then counter stain with counter stain with methylene blue, so that you will get blue color background, and in that if acid fast bacteria are present, they are pink in color. And Mycobacterium tuberculosis bacteria, they are seen as pink color beaded rods, either single or in groups, and they are slightly curved. So here in this picture you can see this acid fast bacteria in blue background, and in 10 cells if you count, no bacteria it is absent, 1 to 2 bacteria, then it is 1 plus. 2 to 10 bacteria, it is 2 plus. 100 to 10 to 100 bacteria, it is 3 plus, and more than 100 means many clumps. If you see, it is 4 plus. So this is a reporting system. So first we will see what is definition of culture media. So culture media is a media required for growth of the microorganisms like bacteria, virus, fungus, parasites, all. So basic, but routinely we use culture media for bacteria and fungi. So now classification of culture media, they are divided into different types. So first is based on consistency. They can be liquid, semi-solid or solid. So in liquid, peptone water, nutrient broth, or in solid, blood agar and other all culture medias. Based on oxygen requirement, it can be aerobic medium or anaerobic medium. So the bacteria which grow in presence of oxygen, they are called as aerobic medium, and the media which do not provide oxygen for the growth of the anaerobic bacteria like clostridium, which do not grow in presence of oxygen, they are called as anaerobic media. So first ingredient is nutrient broth, which contains peptone, that is protein part, then meat extract, sodium chloride and water. And if you add agar to this nutrient broth, it will become nutrient agar. So role of agar is to solidify the media. So concentration used is 2%. If you use 6% concentration of agar, then it prevents swarming of the bacteria like Proteus. Enriched medium, here blood, serum or eggs are added to the basic media, and it is called as enriched media for the nutritional deficient bacteria which grow in presence of the extra added nutrients. So examples are blood agar, chocolate agar, Loeffler serum slope, and egg based media, that is Lowenstein Jensen medium. And then if more than one type of bacteria are present, special substances are added to favor the multiplication of particular species of the bacteria or to inhibit the other bacteria. So they are called as selective media. Examples are selenite F broth, tetrathionate broth, alkaline peptone water, bile broth. Selective media, selective agents are added to solid the media, and which act as an enrichment, but they are solid in consistency. So they are bile salt agar, deoxycholate citrate agar, and TCBS for the Vibrio. Indicator medium, indicator in the media changes color when particular bacterium grows in them. So example of that is blood potassium tellurite agar, Wilson Blair medium. So blood potassium tellurite agar is used differential media which differentiate the colonies from one to another. Example is McConkey agar. So on some delicate bacteria, they need transport media, so it is towards medium, or Venkatraman Ramakrishna medium for Vibrio, Carrie Blair medium for Salmonella, Shigella, Vibrio, etc. Anaerobic medium, so the bacteria which do not grow in presence of oxygen, so media provides deficiency of oxygen in that medium, and they are called as anaerobic medium. So they are Robertson cook meat media and thioglycolate broth media. Some media are there for the growth of the fungal like Candida, Aspergillus, Penicillium, Rhizopus, Cryptococcus. So they are the ideal culture media for fungal isolation is Sabrot's dextrose agar, and dextrose is 4 gram, neopeptone 1 gram, agar is 1.5 gram percent, and distilled water. So here the pH is 5.4, and then because of that other commensals are not grown to this acidic medium. The antibiotic sensitivity testing media is done on Muller-Hinton agar for the antibiotic sensitivity testing, and that is usually done by Kirby-Bayer disk diffusion method. Media. So sticking on the plates is done this way. So it is first you have to take this, you have to heat the wire loop on flame till it becomes red hot, then wait for some time so it will be cool, and then after that you have to take the sample in wire loop and then do primary inoculation. Then from that primary circle you have to draw the lines horizontal, then rotate the plate, then again draw the lines, then rotate the plate, again draw the lines. So this, and then after that tail in the end. So this is primary, secondary, tertiary and quaternary inoculation you have to do, so that you will get isolated colonies to study colony characteristic media. So sticking on the plates is done this way. So it is first you have to take this, you have to heat the wire loop on flame till it becomes red hot. Then wait for some time so it will be cool, and then after that you have to take the sample in wire loop and then do primary inoculation. Then from that primary circle you have to draw the lines horizontal, then rotate the plate, then again draw the lines, then rotate the plate, again draw the lines. So this, and then after that tail in the end. So this is primary, secondary, tertiary and quaternary inoculation you have to do, so that you will get isolated colonies to study colony characteristics. So virus, they are unicellular ultra microscopic particles containing either DNA or RNA which reproduce inside the cell. They pass through filter which retain bacteria and are covered by protein coat. So they are unicellular and ultra microscopic, that means they are not seen under compound microscope. So for them we need electron microscope, and they pass the filter through which bacteria are passing. So they are smaller than the bacteria, so they retain on the filter which is used, they retain bacteria but not the virus. So this is virus. The classification of viruses is depending on the nucleic acid they contain. So either DNA virus, they are called as DNA virus, and RNA nucleic acid, they are called as RNA virus. So in DNA virus mainly it is pox viridae, the example is pox virus, and the disease caused by this is smallpox. Papoviridae, example is papilloma virus, and disease is papilloma. Parvoviridae, example is parvovirus. Herpes viridae, example is herpes virus, and the disease is herpes. Adenoviridae, example is adenovirus, disease is mainly respiratory tract infection. Hepadnaviridae contains hepatitis A and B virus, and it causes hepatitis. In RNA viruses, it is picornaviridae, example is poliovirus, and disease is poliomyelitis. Orthomyxoviridae, example is influenza virus, and disease is influenza. Then paramyxoviridae, example is measles virus, and the disease is measles. Togaviridae, mumps and rubella virus, and disease is mumps and rubella. Bunyaviridae, arenaviridae, rhabdoviridae, example is rabies virus, and disease caused by this is rabies. So this is because of the bite of the mad dog. Then Reoviridae, it is rotavirus, and disease is diarrhea. And Retroviridae, the disease is the virus, example is HIV virus, human immunodeficiency virus, and the example is AIDS, that is acquired immunodeficiency syndrome. And Coronaviridae, the example is coronavirus, and just now we are facing the pandemic of corona, SARS-CoV-2, that is coronavirus. So these are the examples and families of the RNA viruses. Then we will see AIDS. So it is acquired immunodeficiency syndrome caused by HIV virus, and it is from the Retroviridae family. The clinical features, first is the acute. So patient has low grade fever, body ache, headache. Then asymptomatic. Then persistent generalized lymphadenopathy. Then AIDS related complex can be there, in that unexplained fever, persistent diarrhea, fatigue, marked weight loss, uncommon infection, and then in end stage maybe complications, respiratory complications, then gastrointestinal complications, and the patient may get opportunistic infection because of the low immunity. Then common modes of transmission of HIV is very important to prevent HIV. So first is sexual intercourses, then the blood transfusion. So blood or blood products can cause, if they are infected, cause AIDS. So in this blood transfusion, screening is very important for the donor for investigations of 3H, that is HIV, hepatitis B and HCV. Then tissue organ donation like semen, cornea, bone marrow, kidney. So in that also screening of donor is very important for the HIV. Then contaminated injection and injuries may cause AIDS. So in this, disposable syringe and needles should be used to prevent transmission of HIV. Then mother to baby. So in this, mother should be screened for HIV and then decide whether which type of delivery to be done for the baby. So the common modes of transmission of HIV we should know to prevent it. So diseases caused by this fungus it is called as mycosis. So we will have few common examples which are mainly opportunistic fungi. So they cause infection in a person with low immunity. So patient either having diabetes mellitus, or patient on immunosuppression, or patient on steroid treatment, or patient on cytotoxic treatment for any cancer treatment. So few examples. First is Candida albicans. So it causes candidiasis, vaginitis, and oral thrush is common. Oral thrush means white patches you can see over the oral mucosa, and in vaginitis you can see vaginal discharge of the Candida albicans. Then second is aspergillus. So it causes aspergillus asthma or otomycosis, that is ear infection. Then penicillium, it causes otomycosis, that is infection of the external ear. Then Cryptococcus neoformans, it causes cryptococcal meningitis, and this fungus is commonly associated with the AIDS as a opportunistic infection. So parasites, they are organisms that are dependent on living organisms for their life cycle. So first is Entaminma histolytica, which causes disease like amoebiasis. So amoebic dysentery, in that the stool contains blood and mucus, and abdominal pain is there. Then Giardia lamblia, so this causes diarrhea and malabsorption of fat. It is also called as steatorrhea, and there is pain in abdomen. Then Trichomonas vaginalis, it causes vaginitis, that is white discharge in females, and urethritis in males. Then Plasmodium, which is very important. So there are total 4-5 species of Plasmodium. So P. vivax, P. falciparum, P. ovale, P. malari, and one more is new introduced, that is P. knowlesi. The pathogenicity is called as malaria. So in that the febrile stage is there, then cold stage and hot stage, and then sweating stage. So first patient will feel cold and chills, then the temperature is increased, and then followed by sweating. Anemia is there, then splenomegaly is there, in that because of the enlargement of the spleen, and complications like black water fever, pernicious malaria, and cerebral malaria. Many more complications are seen mainly in P. falciparum. Then a few helminths which are commonly found. So Ascaris lumbricoides, so also called as roundworm. So it causes mainly pain in abdomen, then nausea, vomiting, and sometimes intestinal obstruction. And distantly may go to lung and cause symptoms like pneumonia. Then Ankylostomum duodenum, it is also called as hookworm. So it is mainly entering through the skin if you walk barefooted in a field. So it causes iron deficiency anemia. Then Wucheria bancrofti, so mainly it is causing filariasis, so that is obstruction of lymphatics. And then there is elephantiasis of lower limbs, or scrotum, or hydrocele can be seen. So this is caused by the mosquito is a vector in that is Culex.
Definition of infection: it is the process in which pathogenic organism enters, multiplies, and invade normal anatomical barrier of host, resulting in disease. An infectious disease, when clinical manifestations appear, it is called infectious disease. Now let's see types of infections. So primary infection is the initial infection. Reinfection is subsequent infection by same organism. Secondary infection, subsequent infection by new organism. Focal infection, it is localized infection. It can be superficial or deep. Superinfection, the second infection in already existing infection. Cross infection, new infection acquired from other host. Nosocomial infection, it is hospital acquired infection. Heterogenic infection, it is physician or medical paramedical staff induced infection. Depending on source, the types of infections are endogenous infection and exogenous infection. So endogenous infection, it is from within body of host. Example, normal flora. So two types of normal flora, transient flora and resident flora. So transient flora is present at some point of time, not always, and resident flora, they are present constantly. It prevents permanent colonization of body by other microorganisms, that are pathogenic microorganisms.
The exogenous infection from outside body of host, so that is environment, so air, water, food, hospital equipments like thermometers, stethoscope, blood pressure apparatus, bedpan, urinal, trolley, etc. Then healthcare workers, other patients and carriers. Types of infections according to the clinical manifestations, so they can be asymptomatic and symptomatic infection. Asymptomatic when no symptoms are seen, and symptomatic when symptoms are seen. So it can be acute infection when the symptoms are seen for short period, and chronic infection when symptoms are seen for long period, that is more than 6 months of duration. Latent infection when infection is in hidden form. Types of infectious diseases depending on the epidemiological pattern. So it can be endemic, hyperendemic, epidemic and pandemic. So endemic infection when it is persistent in particular area at lower rate. Hyperendemic, the infection occurs at much higher rate than the usual in particular geographic area. Epidemic when infection occurs at higher rate in particular area. Pandemic when infection spreads to large areas of the world. Example, COVID-19. Healthcare associated infection, that is hospital acquired infection, is defined as new infection occurred in a healthcare facility by a patient after 48 hours of the admission, which was neither present nor incubating at the time of admission. Community acquired infection or associated infections refers to the infections which developed in the community or within 48 hours of the admission to healthcare facility. Some infections can be localized. They are present in local area. They can be superficial or deep, and they can be generalized, like bacteremia, presence of bacteria in blood; septicemia, presence and multiplication of bacteria in blood; pyemia, pyogenic bacteria are circulating in blood, characterized by development of abscess in the various organs. Source of infection can be endogenous, that is normal flora. It can be transient and resident flora. Exogenous can be environment or hospital equipments or healthcare workers or other patients and carriers. Sources can be animals, so they are called zoonotic diseases if the infection is from animals. So bacterial infection like plague, viral infection like rabies because of dog, then protozoal infection toxoplasmosis because of cat, helminthic infection hydatid cyst because of dog. So these are animal acquired infections. Then insects, they are called arthropod borne diseases, so they are vectors, can be mechanical vectors like flies, they cause dysentery, typhoid. Biological vector, they cause Aedes mosquito cause yellow fever. So mechanical vector when there are no multiplication or the fertilization. Then biological vector when some sexual cycle present in that vector is called biological vector. Then other source can be soil and water. So bacterial spores can be tetanus. Then parasites like microorganisms causing vibrio, hepatitis, viruses. Then food, it can be external contamination, food poisoning or staphylococcal poisoning. Then pre-existing infection, meat, animal products. Carrier, a person who harbors infectious agent in absence of clinical symptoms but transmits infection via contact or secretions. So the types are healthy carrier without suffering from disease, convalescent carrier who recovered from disease and continue to harbor and shed pathogen from the body. Temporary carrier, they shed organisms for less than 6 months period. Chronic carrier, they shed organisms for longer periods. Contact carrier, acquire pathogen from patient. Paradoxical carrier, acquire pathogen from another carrier. Methods of transmission: contact, like sexually transmitted diseases like syphilis, gonorrhea. Indirect contact can be fomites, inhalation, droplet nuclei, ingestion, waterborne like cholera, foodborne, food poisoning, handborne, dysentery, inoculation, so tetanus, rabies, syringes, needles causes HIV, hepatitis B, hepatitis C because of the blood transfusion. Then congenital, it can be vertical transmission, syphilis, rubella, or iatrogenic can be because of the lumbar puncture, catheterization, transfusion, dialysis, or organ transplantation. Factors responsible for microbial pathogenicity, so they are adhesion. So because of the fimbria, they are adhesion to the host cells. Invasiveness, so it causes spreading. It can be localized or generalized. Toxigenicity, so it is because of the endotoxin or exotoxin. This we will see in detail later slide. The plasmid can be R factor. Bacteriophage, so beta or tox plus gene, bacteriophage in diphtheria. Communicability, spread from one to another individual. Other bacterial factors like thrombin-like enzymes seen in staphylococci, fibrinolysins, hyaluronidase, leukocidins, hemolysins. Bacterial appendages like capsule or bacterial VI antigen in Salmonella, K antigen in Klebsiella. Biofilm is a group of bacterial cells which stick to each other on a surface. Example, prosthetic valve. Infecting dose is minimum inoculum size that is capable of initiating infection. Route of infection, any route or specific route required. So these are the factors causing microbial pathogenicity. Now we will see endotoxin and exotoxin differences. So endotoxin, lipopolysaccharide in nature, exotoxin, proteins. The source, endotoxin, form part of cell wall of the gram-negative bacilli, and exotoxin is secreted by gram-positive and gram-negative bacteria. The endotoxin released after cell lysis, exotoxin actively secreted by bacteria. Endotoxin heat stable, exotoxin heat labile. Endotoxin no enzymatic action, exotoxin action often enzymatic. Endotoxin non-specific, no specific tissue affinity, active very large doses and weakly antigenic, ineffective and not used for vaccine. Exotoxin specific action on particular tissue, specific tissue affinity, active in minute doses, highly antigenic, effective by neutralization antibodies, and toxoid forms are used as vaccine. Example, tetanus toxoid, diphtheria toxoid.
What are the points? Definition, types. It is innate or acquired, and then different types like adoptive, local and herd immunity. So first we will see definition. So it is defined as resistance offered by host against microorganisms or any foreign substances. Then what are the types? So it is divided into two types mainly, innate and acquired. So innate immunity or native immunity, it is the resistance by virtue of genetic and constitutional makeup. So it is present since birth, and then again it is divided into two types, the non-specific and specific. And acquired immunity, it is also called as adaptive immunity. So it is a resistance acquired during the lifetime. It is different from the inborn. And then it is again divided into two types, that is active and passive immunity. Then we will see difference between innate and acquired immunity. So innate immunity, it is present since birth, microbial exposure not required, it acts immediately, no memory present, and mechanism can be barriers like anatomical barrier, physiological barriers or secretory products in the body, and normal resident flora which protect from the pathogenic organisms. And it is divided into two types, specific and non-specific immunity. Then acquired immunity, it is acquired during course of life, microbial exposure is required, it does not act immediately, it takes some time to act to form the antibodies, and then memory is present for the second or subsequent infection, and mechanism is of by T cells or B cells, and it is divided into two types mainly, active and passive, and each is divided into natural and artificial. So now what are the components of innate immunity? This we will see in detail. So anatomical barriers, physiological barriers, then resident flora, phagocytes, natural killer cells and complements present in blood. And the components of the acquired immunity, they are T cells, B cells and complements. So now this we already saw, types of immunity. Innate immunity is non-specific, and then it is divided into species, racial and individual, and again specific immunity, it is divided into species, racial and individual. Now we will see factors responsible for the innate immunity. So it is age, extremes of ages. So extremes of ages, they have low immunity. Then hormonal influence. So endocrine disorders like diabetes mellitus, hypothyroidism, they increase susceptibility to infection. So that means low immunity. Then nutritional status. So malnutrition, this cell-mediated immunity, and hormonal, humoral immunity, that is antibody-mediated immunity is low in malnutrition. The mechanism of immunity, innate immunity, so this is first line defense. So examples are, first is anatomical barrier.
So skin, mucosa. So skin, intact skin and mucosa prevent entry of microorganisms. The sebum present in skin, it is antimicrobial. The mucosa prevent entry of microorganisms. Mucus, cilia, they are present in that mucosa, propel microbes outside. Example, cilia in respiratory tract. Then coughing, sneezing and urine flush, these all mechanisms, they remove bacteria. In secretory products, they inhibit growth of microorganisms. So few examples are there. So in saliva it is lysozyme, in tears it is lysozyme, in gastric juice it is HCl, trypsin and protein digesting enzymes are present in intestinal juice. Then bile salts, they rupture the bacterial cell membrane and then thus cause the killing of the microorganisms. Then lactoferrin bind to the iron and inhibit bacteria. Spermine inhibit bacteria in semen. Sebum contains chemical toxin to kill the bacteria. Then physiological barrier, so temperature which inhibit growth of the bacteria. Low pH, that is gastric acidity, inhibit growth of bacteria. So here you can see examples of non-specific defenses. So mucous membrane are physical barriers to microbes. Lysozymes present in tear and saliva. Then mucus coated hairs in the nose trap inhaled particles. Mucosa of the upper respiratory tract is ciliated, and that cilia in trachea help moving out the bacteria away from the lower respiratory passage. Flushing mechanisms like coughing, sneezing, lacrimation, salivation, peristalsis, urination, so they all help to flush out the microorganisms. Then gastric, so that hydrochloric acid neutralizes Helicobacter pylori neutralizes acidic pH, and that is why Helicobacter H. pylori grow in stomach. So blood complements iron binding proteins like lactoferrin, transferrin. So they all inhibit growth of microorganisms. Lysozyme, enzyme that degrades peptidoglycans. So gram positive bacteria are more susceptible than gram negative bacteria. Then now we'll see acquired immunity. So acquired immunity is divided into naturally acquired and artificially acquired. And naturally acquired is again divided into active and passive. So we'll see example of active and passive. So active antigens enter the body naturally. Body produces antibodies and specialized lymphocytes. In passive, antibodies pass from mother to fetus via placenta or to infant in mother's milk. Artificially acquired active antigens are introduced in vaccines. Body produces antibodies and specialized lymphocytes. In passive, preformed antibodies in immune system, in immune serum introduced into body by injection. So now we'll see comparison of active and passive immunity. So active is produced actively by host immune system. So host participation is required in active immunity, induced by immunogen or infection. It is durable and effective protection is there, and immunity effective only after a lag period. So some period is required to build up the immunity, that is production of antibodies, so that is called lag period. In passive immunity, it is received passively, so host participation is not required. Then it is in ready-made or form, it is transferred. It is transient and less effective, and immediate immunity, in that lag period is not there because it is a ready-made form.
So in active immunity, immunological memory present, booster effect on subsequent dose is present. The negative phase may occur because of the previous antibodies, and then not applicable in the immunodeficient persons. In passive immunity, there is no memory, subsequent dose less effective, but no negative phase and applicable in the immunodeficient people. Then we'll see types of acquired immunity. So that we already saw. Acquired immunity is resistance acquired during the lifetime. It is of two types, active, and then active is again of two types, natural and artificial. So example of natural immunity is following natural microbial infection, and artificial is because of the vaccines. And then passive, it is again divided into natural and artificial. So natural example is immunity transferred from mother to fetus, and artificial through the immunoglobulins or ready-made antiserans. Then naturally acquired, it is clinical or subclinical infections. We already saw response to a bacterial or viral infection. Example: chickenpox, smallpox. Artificial acquired active immunity, response to a vaccine of dead or attenuated pathogens. Immunity is provided by the vaccination. Then now we'll see a few vaccines. So vaccines are preparations of live or killed microorganisms or their products. So there are bacterial or viral vaccines. So and there are different types. So live vaccine, example of bacterial is BCG and viral OPV. Killed vaccine, example in bacterial is cholera and in viral it is Salk, that is for the polio. Then subunit vaccine, it is typhi VI in bacterial and viral hepatitis B. Then toxoid, it can be tetanus in bacterial. So we'll see a few differences between live and killed vaccines. So live vaccine advantages: single dose is sufficient, induces local and cell mediated immunity. It is more effective and long lasting, cheaper and used for mass immunization. Advantages of killed vaccine: stable and safe to administer, can be given in combination with polyvalent vaccine, no danger of spread of vaccine oriented infection. Then disadvantages of live vaccine: the reversion of virulence possible, can spread from vaccines to contacts, pre-existing viruses can interfere, cold chain has to be maintained, few cause local and remote complications. Disadvantages of killed vaccine: multiple injection, that is booster dose is required, and local immunity and cell mediated immunity is not induced. Then passive immunity. So passive immunity, when ready-made antibodies are transferred to a recipient, the recipient's immune system plays no part. It is called passive. It is only transfer of the antibodies or immunoglobulins. Then it is of two types, natural and artificial. So in naturally acquired, from mother to fetus via placenta, or examples are breast milk, so it contains IgA and monocytes. Colostrum, it contains bifidus factors, antibodies that protect newborn from the gastrointestinal infections. Then IgG, a type of antibody that is transplacental and protects infant up to 3 months. Then artificially acquired, from the injection of serum such as gamma globulin. The method of collecting an IgG from an infected immune person and transferring this immunity to an unprotected person, sometimes given to infants who are not producing enough antibodies. Example: ATS and ADS, that is anti-tetanus serum or anti-diphtheric serum.
Hello students, today we will talk about immunoprophylaxis. So prophylaxis is, what is immunoprophylaxis? It is prophylaxis against the microbial pathogens. So it is given in two ways, that is active and passive. So active immunoprophylaxis usually given in form of vaccine. So what is role of vaccine? It stimulates immune system of the body to produce immunity in form of protective antibody by B cells or T cell response. And passive is given by immunoglobulins, which are the ready-made immunoglobulin preparation against pathogenic microorganisms. They act without faster without involvement of host immune system. That is passive. And example is diphtheria antitoxin or tetanus antitoxin. So vaccines are of two types, live and killed. Third subunit recombinant vaccines are also available nowadays. So we'll see difference between live and killed. So live advantages: a single dose is sufficient, which produces local and common, that is immunity, and then it is more effective and long lasting. It is cheaper and usually used for the mass immunization. But disadvantage means virulence may be there because of the live virus is used, and for that cold chain has to be maintained. Killed vaccine, they are stable, cold chain has no the role in that, and they are safe to administer, no virulence of vaccine virus is there. But disadvantage, you have to give multiple injections or booster doses, and local immunity is not produced. So example of few bacterial vaccines like BCG, used for the Mycobacterium tuberculosis, cholera, typhi, tetanus, or viral vaccines like OPV, SALK used for the poliomyelitis. So this is immunization schedule given for the children. So first on the birth, within 1 week of the birth you have to give BCG, then polio, and then 1.5 month, 2.5 month, and 3.5 month you have to give DPT along with polio, hepatitis B, and then after that you have to give booster of the DPT, then DT, TT at the age of 5 years, and then at the age of 9 months you have to give MMR, that is mumps, measles and rubella. You can give vitamin A at the age of 9 months, and then vitamin A booster dose at the age of 16 months, and DPT booster to 5 years, and TT at the age of 10 years. So these are routine vaccination schedule. And hepatitis B you can give at the birth or as early as possible, then after that 1 month, and then 6 months. So 3 doses of hepatitis B, that is 0, 1, 6. So these are common vaccines, and extra vaccines you can use as Japanese encephalitis or Hib vaccine or other vaccines according to the endemic involvement. Thank you.
So now we'll see definition of antigen. So antigen is defined as any substance that satisfies two immunological properties, that is immunogenicity and antigenicity. So what is immunogenicity? It is ability of antigen to induce immune response in body. And what is antigenicity? It is ability of antigen to combine specifically with antibodies or T cell surface receptors. Then we will see epitope. So what is epitope? It is smallest unit of antigenicity. It is also called as antigenic determinant. And there are two types of antigenic determinants. One is sequential or it is linear, and it is mostly seen in T cells. And second is conformational or non-sequential epitope. So it is mainly associated with the B cells. Types of antigen. So there are two types, complete antigen and incomplete antigen. So complete antigen, when it induces antibody formation, it is called as complete antigen. And incomplete antigen is also called as hapten. So it is incapable of induction of antibody formation. Now we'll see incomplete antigen, that is hapten. So definition is they are low molecular weight molecules that lack immunogenicity but retain antigenicity. So there are two types again. One is simple hapten and second is complex hapten. So simple hapten is univalent, contain only one epitope, that is antigenic determinant, and complex hapten, it contains two or more epitopes, and haptens can become immunogenic when combined with larger protein molecule called carrier. Means they can produce antibody when they combine with the other protein molecules.
What is antibody? Antibody is produced in response to antigens and they react with the antigen. They are protein, also immunoglobulins, part of gamma fraction of serum, found in circulating in blood, plasma, lymph or mucus, or fixed to cells or tissues, and it protects against bacteria, exotoxins and viruses. So they are proteins synthesized by host in response to exposure to foreign substances. All antibodies are proteins. Antibodies are gamma globulins or immunoglobulins, are produced by B lymphocytes, beta lymphocytes, that is plasma cells, and response to antigens. The structure of antibodies. Antibodies are gamma globulins with molecular weight of 1,50,000. Two pairs of polypeptide chains are there. One pair of heavy chain, one pair of light chain. Two halves are held together by disulfide bonds. The light chain and a part of heavy chain form one arm and remaining part of heavy chain form another arm. The light chain contains kappa, that is corn gold, or lambda lapari. Two regions are there, constant region and variable region. So the variable region end forms the amino terminal, that is FAB, and it is attached with the antigen binding site. The end constant, that is CH, it is carboxy end, it is also called FC. The hinge region is junction between CH1 and CH2 and it is sensitive to enzymatic digestion. Types of antibody is according to H chain and it is designated by Greek letter. So now first is IgG, the H chain is gamma, IgM, the H chain is mu, then IgA, the chain H chain is alpha, IgD, H chain is delta, IgE, H chain is epsilon. First immunoglobulin is IgG, which constitutes about 70 to 80% of total immunoglobulins of the body. It has maximum daily production and highest serum concentration. The function: IgG can cross placenta, hence provide immunity to fetus and newborn. It is complement fixing phagocytosis. This IgG plays a major role in neutralization of toxins. It is raised after a long time following infection and represents chronic or past infection. IgA, it is dimeric in nature. It has two monomeric units joined by a J chain. Secretory component. The location of IgA is found in body secretions like milk, saliva, tears, intestinal and respiratory tract mucosal secretions. Function: local or mucosal immunity. It is effective against bacteria like Salmonella, Vibrio, Neisseria and viruses like polio, influenza. Breast milk is rich in secretory IgA and provides good protection to immature infant gut. IgM, the highest molecular weight and pentameric in structure. It present is only in the intravascular compartment and not in body fluids or secretions. Function: it represents acute infection, fetal immunity, protection against intravascular organisms and mediate agglutination. IgE, it has affinity for the surface of tissue cells, mainly mast cells of the same species. It is extravascular in distribution, mediator of type 1 hypersensitivity. Ig is elevated in helminthic infections. IgD is found in membrane immunoglobulin on the surface of B cells and act as B cell receptor along with IgM. No other function is known for IgD so far.
Hello students, today we will see serological test. So first is RA test. So it is rheumatoid arthritis test. So clinical significance is RA test is done to detect presence of rheumatoid factor in patient of rheumatoid arthritis. So rheumatoid arthritis is a disease of the old age patients in that all the major joints are involved. Procedure: in short, you have to take three circles, label it as test, positive control, negative control, add serum to test, then positive control 1 drop to PC and negative control 1 drop to MC, and then add antigen provided in the kit, mix and wait for 2 minutes and then see for the clumps. C-reactive protein CRP, it is also done same way. Take taste, positive control, negative control, and then add serum and then reagent and mix and wait for 2 minutes and see for the clumps. So C-reactive protein significance, it is mainly a inflammatory marker of inflammatory condition of infectious or non-infectious origin. So when the WC count is raised, ESR is raised, CRP is also positive. Antistreptolysin O titer, that is ASO test, it is done for the investigation of rheumatic fever. It is a post streptococcal disease. In that, antistreptolysin O titer is raised and procedure is same as RA and CRP. You do take three circles, test positive control, negative control, add serum, PCNC and add reagent and then mix and wait for 2 minutes and see for clumps. Thank you. Hello students, today we will see serological test, that is Vidal test and VDRL test. So Vidal test is done for diagnosis of the typhoid fever and paratyphoid fever, that is caused by Salmonella typhi and paratyphi A and B. So in that, what is the principle? So in that, four antigens are there: O, H, AH and BH. So O is pink color, O is blue color and H, AH, BH are pink color reagents. So procedure: by slide method, you have to add 1 drop of serum, 1 drop of positive control, 1 drop of negative control, and then you have to add, so the total 4 drops you have to take to add 4 antigens of the serum, and then add 1 drop of O, H, AH and BH antigen, mix and then wait for 1 minute and then see for the clumps. So if clumps come within 1 minute, then it is the positive test. So O and H for the typhoid fever, AH for the paratyphoid A fever, and BH if clumps are there, then it is for paratyphoid B fever.
Then VDRL test, so it is venereal disease research laboratory test, method by slide method. Again here you have to take 1 drop of serum, 1 drop of positive control, 1 drop of negative control, then add antigen to each one drop, and then mix and rotate for 8 minutes on the VDRL rotator or by manually, and then see for the clumps. So here you will see floccules. So report can be done if no flocule seen, non-reactive; if weak flocule seen, weakly reactive; if strong flocule seen, it is strongly positive. And then significance, it is done for the diagnosis of the syphilis test, and syphilis is caused by Trypanosoma pallidum spirochetes. It is a sexually transmitted disease, and then it should be done usually in pregnancy to rule out congenital syphilis, because in that baby may get stillbirth, IUD, or mental retardation. So that syphilis test is done. Thank you. Hello students, today we will see Montague's test. So in short, what is Montague's test? It is also called as tuberculin test. So it is done for the diagnosis of the Mycobacterium tuberculosis infection in a patient. So in that, what is the principle? So in Montague's, that is PPD, protein purified derivative, is given intradermally, and then after 48 to 72 hours you have to see induration, that is swelling, and erythema, that is redness. So what are the uses of Montague's test? Usually for the diagnosis of suspected infection by Mycobacterium tuberculosis, or epidemiological survey of the tuberculosis, or post-vaccine checkup of the BCG vaccination, or in cattle also we can do for the diagnosis of the tuberculosis. So procedure in short, you have to take left forearm, clean it with 70 to 80% alcohol, then make a round with the pen in that area where you will give prick. So with help of 0.1 ml PPD into the tuberculin syringe or Montague syringe, that is 4 lines in that you have to take, and then inject superficial layer of the skin, that is intradermal, and then after injection you will find swelling, that is bleb over the skin prick, and then that means your injection is intradermal, and then ask the patient to come after 48 to 72 hours. So in result or interpretation, if induration, that is swelling, is more than 10 millimeter, then it is positive. If it is less than 5 millimeter, it is negative, and in between 5 to 9 millimeter, it is doubtful. So you have to repeat the test. Thank you.
Hope you find this session useful for your understanding and for your exams. Thank you.